ISER is something that all of us look forward to, scientists and veterinarians alike. Things have probably changed a little bit for myself over the years, as in I find it probably harder to follow the science now than I used to. And the science is different. You know, it was a time where, as veterinarians, we would go along to that meeting and we would walk away with things that were instantly applicable to what we were doing in day-to-day life. Nowadays, there's a fundamental shift in basic science, and we're seeing a lot of wonderful science. The science is better than it's ever been, but it's not necessarily something that's got an immediate effect on our day-to-day lives. So I've tried to grab some presentations that I thought would be of interest to you. I've certainly eliminated all the presentations where I didn't understand the data properly, which unfortunately, there's nothing the matter with the data. It's just the person interpreting it that was the issue. The first ISER was established here in Cambridge, and so this is the first opportunity that we've had to come back, and it's been wonderful, and we've had a wonderful week. We've got great scientists, international collaboration, good sponsorship, and we've all had a wonderful time sharing. And there's a lot of it is sharing things. You know, it's not just about listening to the presenters. It's having a cup of coffee and speaking to a scientist who might give you another idea, or it's sharing an experience with another vet, or, you know, it's very much about that. So there were 75 oral presentations, 124 posters, about 300 delegates, and we're very grateful to our platinum sponsors. Without that sponsorship, I think $30,000 of that sponsorship from these people goes towards travel grants for young scientists. There's a big shift in the meeting, a lot more young people at the meeting now. It's just wonderful to see the work that they do. They wouldn't be able to get here if it wasn't for that kind of sponsorship. And the program was divided into stallion, non-pregnant mare, conception and early development, and the pregnant mare, and you can see the number of presentations, oral presentations in each of those groups. So the first one is not necessarily something that you'd be excited about as thoroughbred breeders, but it is a very interesting paper for all of us involved in the reproductive world, and that's Samira Gibbs' group from the University of Newcastle in New South Wales, who have been developing a liquid extender that enables us to ship semen from one side of the country, probably all around the world, without having to chill it. And so when a stallion ejaculates, if we want to store the semen, we've got to add an extender to it, and we have to chill it down to stop the amount of metabolic usage of the sperm. And so the challenge has always been to work out what substrates to put in to add to the sperm to maintain not just the motility, but the viability of the sperm. And so Samira's group have been able to produce an extender, we're not allowed to know what it is, that's able to hold the semen without it being chilled, so 17 degrees, for a period of a week, which is just absolutely amazing. Like at the moment, 48 hours is the longest time period that we'd ever consider holding chilled semen. And you can see here the binding to the oocyte that she's demonstrating. Quickly show, you know, not just does it survive, you have to be able to say not just that it's motile, but that it is going to cause mares to get pregnant after it's been stored. So she looked at breeding mares with semen that's been stored either 3 days or 7 days in her extender, and she had very good fertility on the 3 days and very good fertility on the semen stored for 7 days. Now, she hasn't bred many mares, and there'll be a big trial that goes on this breeding season in the Southern Hemisphere, but it's a game changer for the world of artificial insemination. You know, if you wanted to have semen come to England from Australia or vice versa, we would typically freeze that semen if we wanted to import it. and now we'll be able to ship it chilled, which will be, theoretically, should give us an advantage in the cost of it, theoretically. Part of understanding ISER is to understand advancements and what those advancements can do for you. This, I think, is a big advancement. So flow cytometry's been around for a while, but Stuart Myers at Davis, California Vet School showed the use of a flow cytometer that then enabled you to do morphological analysis. So normally a flow cytometer will break whatever you're looking up into different areas, and you'll be able to say if it's alive or it's stained or it's this or it's that. But the actual ability to look at various morphologic abnormalities, this is looking under a microscope, probably differential interference phase or phase contrast, enabling us to look at the morphology of the sperm. And Dixon said to you before, and I totally agree with him, that morphology is absolutely fundamental to understanding sperm. But we can look at maybe 200 sperm in a 3 or 4 minute period. This machine will address morphologic abnormalities on the sperm, hundreds of thousands in the same time. And so that is likely to make a big difference to us in the future, we think. And are really looking forward to Stu's work that he's doing in that area and the advances that it's going to show us. A paper that Karen Woolstoff presented, many of you would know Karen, from Kentucky, veterinarian in Kentucky, was of interest because bringing horses through the transition period, bringing mares through the transition period to where they're actually ovulating in the season is a challenge for all of us. And I'm sure many of you use artificial lighting programs where we give the mare 16 hours of light a day. That is time-consuming and expensive if you box them, and the Irish advance of the Equiloom has been a wonderful addition to our armament in Australia, and particularly as Dixon said before, we do like to have horses outside, and we do think that impacts on the fertility. At least that's my take-home on it. But she would like to present, or I'm presenting on her behalf, some work that she's done with pharmacological manipulation. So Cliff Irvine many, many years ago showed that you could use the hormone from the brain, GnRH, you could use that hormone to make the mare cycle, and it would take about a 14-day period. But what he also showed was that if you had a mare that wasn't cycling and you pushed her into the breeding season, that she wouldn't continue to cycle. The work that Karen's done here with this drug Burserelin has been quite good, showing us that we can get a good percentage of mares to come into the season in a reasonable, quite reasonable time period if they're treated with this drug, rather than having to be exposed to the long. Normally you have lights for at least 60 days before you'd expect an effect, whereas in her program she had the lights on for approximately 2 weeks or a little bit longer, and then she added the drug and she had a very good result. Now, she didn't have any controls, which is not ideal because it's a clinical setting. Often you don't get controls, but based on previous experience that we've all had, this is good in that she was able to get so many mares to come into heat and ovulate early and go in foal earlier. This was one of my favourite papers because I could understand it properly, because it was very visual. And Kirsty Gallagher at University of Adelaide was an intern of ours many, many years ago, and she went to the States, and she's a Scottish girl. And she is the only one to work in this area of confocal laser endomicroscopy, which basically takes the camera, if you like, but it's a bit different, and focuses it on the tissue when you pass it through an endoscope into the uterus. So like those other images that I showed you before of us looking at the cysts and things like that, well, the camera goes in there, but what it does is it doesn't actually view it in a single plane like we saw on the cysts and everything. It actually cuts through the tissue, sampling at different depths, and then puts the image back together again. Until you see the picture, you probably won't understand exactly what I'm saying. So she calls it a virtual biopsy, and it's absolutely fascinating to see. So here's a real biopsy. We've taken a chunk of the tissue, and we've cut it, and we've stained it, and that is the surface of the uterus, and these are glands that produce substances that help, for example, help maintain pregnancy in the foal. And so here's the first example of her picture that she's been able to obtain with this endoscope with the imager inserted inside it. So this is a video endoscope. This would be, like what you saw before, looking into the uterus, and here's her image that she has of the surface of the uterus. So you can see here, we've got folding of the uterus. Oh, you have to stain with fluorescein, and she just showed us how messy the stain could be. But so here's an electron microscopy, a scanning EM, which is very time-consuming and difficult to prepare. And here's her equivalent image, which has just got so much wonderful detail. It's just absolutely, it's absolutely unbelievable. This is the folding of the mare's uterus that you can see. This is the surface of the uterus. It's not so folded, and these holes are just where the uterine glands are opening onto the surface of the uterus. Now remember, to see this, we're not actually cutting anything, we're just looking and sampling and putting the picture together inside the computer. And so here's more glands, opening of the uterine gland, and this is going deeper into the tissue, showing how long the glands are, how tortuous they are. And yet we haven't had to take a sample. We haven't had to send it away for an analysis. We've just looked in there, and here's just such wonderful pictures. You can see blood vessels. You can see individual red blood cells passing through the tissue inside veins. You can see here as well. Just absolutely amazing. She hasn't done a lot of pathology studies yet, but because it's taken a long time to develop the techniques to get such beautiful pictures. But here's a normal biopsy and one of her normal pictures that she's made, C pictures. And then here's an ulceration. You've got a change on the surface. Maybe it's might be processing, I don't know, but there's a bit of an ulcer on the surface of the loss of epithelium here, and that's how it's represented on her confocal image. And inflammatory cells on the biopsy, there's neutrophil here, some lymphocytes, and you can see, well, I hope you can see, but these are neutrophils here. And we haven't had to send it away, it's just had a look inside. It's just absolutely fascinating. Fibrosis, normally the glands themselves would be separated from each other, or if they're clustered, they shouldn't have any fibrous tissue around them. There's a slight increase in fibrous tissue there. It's not the best slide, but you can see clearly fibrous tissue circling the uterine glands, and a vessel here. Look, I would never have realised that the glands were like that they were that deep. I mean, we see them histologically, and that's it. That's the first time I've ever seen what I now know to be such deep glands. She's had you can see a fungus here, and you can see it in real time in the uterus. Yeah, so I think it's really quite exciting stuff, and looking forward to seeing more work done in that area. Babish from LSU, Louisiana State University, and her group, she actually won the prize for this presentation, the Junior Presenter Prize, which was a very good effort. Looked at microbiome. I suppose microbiome might be described as a bacterial population that we don't normally culture. They're very difficult to culture, but they're in the background, and they probably occasionally contribute to disease, but more often they probably contribute to maintenance of the normal flora of bacteria in various areas. And there are now quite a lot of studies in humans on microbiome, and the animal scientists are now aiming at at performing them themselves. So she wanted to characterise the uterine microbiome in healthy mares from 4 different sites. So she waited until they were in heat, and then she sampled them, either a cervical swab, a uterine swab, low volume lavage, or a biopsy, like that. And then she was able to show that all these different shades, looking at this technique will pick up all different types of bacteria without making them grow. And she was able to show that it probably didn't matter what technique you used. Maybe you had more information from low volume lavage, but they were pretty repeatable between the different techniques. So there's thousands now of these bacteria that we're just not exactly sure what it is that they're doing, but we didn't even know they were there, and you wouldn't have known they were there if it wasn't for studies like what she presented. And looking at the time, I'm assuming you'd like to finish close to 1, would you?
Yeah, we'd like to try and finish 1 or just...
Yeah, okay, well that's fine. I'll finish here. I mean, you'll see when you look at your PDFs, I've chosen a lot more talks than I've chosen to talk about. I've probably selected 20 talks, and that we're going to talk about 5 or 6 because you can't talk about them all. The last one, I thought was of interest because we all breed horses, and there was a really good take-home message, I thought, from this study. I mean, it's not new, this is new information, but the technique that he has talked about has been around for a little while. So we see horses that develop infections, and most of the time we can just treat them with an antibiotic in the uterus when they're in heat, and they're not infected. You can usually even breed them that cycle, and they're not infected because you've treated them. But sometimes you'll have mares that are bred repeatedly. They don't have a big reaction to the bacteria that are still there, but they are still infected. And you can't grow them very easily, but they're still infected. And I think you saw the beautiful slide of Kirsty's before about those deep glands and the openings. I think now I'm starting to understand why sometimes it's pretty hard for us to get things properly clean. And so what Mckinnon has done is he's shown that there are, if just with Strep zooepidemicus or Strep equine variation zooepidemicus, that there are various states that the bacteria can live in outside of what we normally regard as a bacteria being there and being able to culture it. And so these would be the normal Streptococcus bacteria that we would grow on a dish. And occasionally there'll be these ones that take a lot longer to grow. And so if you don't leave it in the culture system long enough, then you may miss them. And then occasionally there'll be nothing that grows because they're in this persistent state where they're hiding in the glands. And so to try to explain that, it would be to say that in this uterine environment, we've got a lot of normal bacteria, we've got some dead bacteria, and we've got these persistobacteria, just one here. And then so we treat with antibiotics, and only thing left are the persistobacteria. And they then, when the antibiotic is removed, they then can be there to create problems again in the future. And so where do they persist? They persist in the glands and under the surface of the epithelium. And so you can see here a gland with a stain to stain the bacteria and showing that it's in the actual lumen, in that hole, that big tube you saw of the gland before. And here in the luminal epithelia underneath the surface you can see them. And this is a beautiful shot, isn't it? Just showing the bacteria localized, not so much on the surface of the uterus, but deeper. And so what they did was and this involved Meta Osborne from Ireland as well, they took a population of horses and demonstrated that when you infused phosphate buffered saline into the uterus and then cultured them, that in those mares that had been about 3 cycles negative, I think, they had no growth of bacteria in the majority of those mares. When they infused the B activate in before doing the culture and then cultured the mares later, they had a very high positive culture rate. So the substance that he's infusing into the uterus is allowing the bacteria to grow and become available for culture. Now, if it becomes available for culture, it becomes available for treatment. So the B activate that he's using is actually waking up the bacteria, so to speak. He's not treating it, he's waking it up, and he's giving us the opportunity to treat it. So we put that B activate in there, the bacteria grow, then they're able to be treated, as distinct from when they're kind of hiding in the glands. And that was just to show that it was not a contaminant effect. And so this is the summary of of their work. They had 19 mares. This is the age and range. And then they went and activated those mares. They had a pretty bad history, these mares. So they've been barren from 1 to 3 years. They've been bred an average of 6 cycles before they were given the B activate. And the cycle after, they had 16 of 19 mares grew the bacteria where they hadn't been able to grow it before they activated it. Sometimes I wonder if if the B activate's not strep itself, but anyway, it can't be. And look at the results. Surprisingly, for mares that have been bred 6 cycles, and all of a sudden, almost 90% of mares got pregnant that season from mares that were activated, which I thought was great. I thought, very interesting. It's not like it's the biggest problem associated with bacterial endometritis, but it's a solution to one of the problems that, A, a lot of us didn't quite understand happened, but B, now we understand it, we've got a mechanism of handling it. And in time, we might find that there are other bacteria, not just Streptococcus, that there are other bacteria that can also hide and can also be activated, either that way or another way. So I thought that was pretty good. Right, I think I've got us back on time.
Well done. Thank you very much.
Thank you.